Hello parents, thank you so much for supporting Probaby, and today I'm here in Kakinada Vihan Hospital with Dr. Sowmya ma'am, MD Pediatrician, and we are going to talk about child health and development. So I'm here with Dr. Sowmya ma'am, so let's ask all our questions to ma'am and get her advice. Hello ma'am.
Hello, thank you.
Thank you ma'am, thank you so much for giving me your
Thank you for
time.
inviting me.
Yeah.
Yes.
So many parents have questions related to speech delay. So now let's understand from ma'am, like what is speech delay, how to find out the signs of speech delay, and what kind of action is required.
Okay, now what is speech delay? Suppose if your child is not able to speak at least 8 to 10 words by the end of 18 months, then we should think of whether your child is having little bit of speech delay. We should get a clue, like we need to understand. So I want to tell all the parents some signs to differentiate between speech delay and autism, because most of the parents and also even most of the doctors misdiagnose a speech delayed child to autism. This I want to differentiate between these two. Suppose if your child is making eye contact whenever you're calling your child by name, if he or she maintaining a eye contact, it is not autism. So usually a child with autism spectrum disease do not maintain the eye contact. So this is the first differentiation. Secondly, the child responds to his name. So when you are calling, the child suddenly turns to the person who is calling the name, and the child will respond. But a child with autism usually doesn't respond whenever they called by name. So a child with speech delay usually understands everything. So if we give a command like bring water bottle or bring a book, the child will understand, but he or she doesn't speak a word, and they always communicate by nodding yes or no, but they won't tell any particular word or speak anything. So if a child is able to understand what you are saying, it is not autism, it is a normal speech delay. So speech delay can be easily corrected. It is not at all difficult. If you can able to identify by the end of 18 months, you can give speech therapy to the child. And moreover, try to avoid screen time. So these days we have lot of nuclear families with there are very small families without grandparents and all. So most of the parents are working, and also children are being exposed to lot of screen time. So that is the reason why the speech delayed cases are becoming prevalent nowadays. So if you can identify a child by the end of 18 months, there are a lot of educators to help regarding the speech delayed children. But and the other thing is the autism. Even autism also, it is not very much difficult to treat. So those children who are not maintaining the eye contact, or if they are not responding to the sounds, immediately we need to check for this autism checklist. And one more important point is the autistic children, they are very intelligent in some areas. Their brain works very sharp in some areas. So they're able to recite all the alphabets, all the colors very easily, but they won't maintain the eye contact, or they won't be able to respond whenever we call by name. So usually many parents get wrong belief that my child is speaking well, telling all the alphabets, the child is telling all the colors. So they won't believe that their child is having little problem with the autism. So at that point I want to tell, so even if your child is very sharp, telling all the colors or alphabets, if your child is not maintaining eye contact or not responding or not playing, not imitating or not pretend playing, immediately try to take a professional help, which will really help the child to get over it. So it is not like autism is like it is very much treatable if you can identify early. So this point I want to tell all the parents. So speech delay is anyways very easy to correct. By the end of 18 months, if you can identify, they are educators, they are speech therapists, and even if you can cut down the screen time for exactly 3 4 months strictly, immediately the child speaks very well. So I think this differentiation I want to tell you.
Thank
Okay.
you. Thank you so much.